Well, your little one is suffering, sniffling, and like many parents, you're heading to the medicine cabinet, ready to grab one of those medications for your child's cold and cough. But before you do, listen to this. CBC News has learned that Health Canada is about to issue an advisory on those drugs. It might stop you in your tracks. Here's Red Sharon with the details.
Let's wait for those.
Little Andrea Sychuk has another cold, and with the cold and flu season just beginning, it's a worry for her mom, Lisa.
You know what, when your child is sick, and especially when they can't communicate and express and tell you what's wrong, you're going to give them anything because you're thinking this is going to fix it.
There is no shortage of non-prescription cough and cold medications aimed at moms with young children. The problem is there's little evidence they work, and now growing concern about the potential dangers.
Let's send a clear message. It won't make them feel better, and there may be some risk. Don't use it.
Earlier this year, the American Food and Drug Administration completed an internal review of serious and life-threatening effects and deaths in young children dating back to 1969. It found 54 deaths related to decongestants and another 69 related to the use of antihistamines. In many cases, the child was given the wrong amount of medication. Thousands more wound up requiring medical attention. Dr. Reeder says, given the fact there's no solid data that these medicines even work in young children, why take the risk?
Because of what they're used for, which is really the symptomatic relief of common cold, any risk is unacceptable. So risk of death would be unacceptable in babies.
The American Food and Drug Administration is now preparing to revise its policy. In a written response, Health Canada says it is aware of the American review and is now conducting its own assessment on the safety of these products. Health Canada is expected to issue an advisory within days. The industry has confirmed it will change its labeling to say, do not use in children under the age of 2, but it also wants more study.
These medicines play an important role in people's lives. They've been used for, there have been literally billions of exposures to these products. People have been satisfied.
Maybe, but Dr. Reeder says beyond the warning, he'd like to see other labeling changes as well.
I'd like the companies not to advertise showing pictures of little babies taking these preparations because it gives the impression that they're safe and effective.
Sychuk doesn't give little Andrea cold medications anymore.
Oh, that's probably nasty.
She never thought the medication really helped, and now she prefers to let nature take its course. Red Sharon, CBC News, Winnipeg.